The article being reviewed is Influencing Healthcare in the Legislative Arena. First, take a look at the author, Sheila Abboud, PhD and RN. She initially earned her MS in Nursing Health Services Administration from the University of Michigan and then a PhD from George Mason University in the late 2000s. She was the editor of Capital Update, American Nursing Association's monthly electronic legislative newsletter. She was also a director of government affairs at Michigan Nurses Association, where she planned and promoted an associative legislative program for 8 years. Currently, she's a professor of sociology at Grand Rapids University. So just a quick overview of the article. Nurses, I picked a quote, nurses need to be strong voice, actively advocating for positive change. Nurses strengthen their power base when they network with nursing colleagues and others supporters to build consensus on important issues. So basically work through organizations to change legislation. The author outlines the complexities of the medical field and the issues with nurses and patients, and is a big fan of patient advocacy. She notes that nurses can change. Nurses have the choice to continue trying to make do while feeling victimized by current changes, or they can do something. They can motivate themselves to take action. Most of the article focuses on non-specific ways for bedside nurses to be a little bit more proactive rather than giving specifics about how an APHN can create any real change. So, ways to advocate for healthcare. Now, a quick quote. Many state nursing and specialty nursing organizations sponsor annual state legislative days, offer policy internships and fellowships, and conduct policy workshops, all designed to give nurses an opportunity to learn more about health issues. Later, she goes on to speak about the complexities of changing legislation and notes that it's not particularly that easy. And then she goes on to say that if you really want to do it, you need to convince media, get other people on board, and put a concentrated effort in to create any real change, although no specifics were given. One of her main points is to be part of a professional nursing organization. So she goes a lot on about sources of power. So these sources of power are expert power, the ability of nurses to have validity in what they do because of their experience and education. They have legitimate power, which is their nursing license. They have referent power, which is having the trust and respect of others. They have reward power, which is giving something in change for a change in law, which might be legal. And then coercive power is the ability to punish and inflict fear. And then she says that if you're trying to create change, you use a myriad of these types of powers and helping to create change. So we'll go into the process. So the process for her is simply creating a plan and then implementing the plan. And then you hand it off to a legislator and they manage it. It is good to understand the connection between policy and legislative procedures and how the bill becomes law. It's also good to know where to start and where legislators in your area might be, who they are, and how to support them. Understanding committees is very important, and learning how to manipulate them, how to speak at them, how to convince committees of your issue. And then understanding how to communicate with legislators. She makes a point of being very short and specific as not to waste their time. So just a conclusion and a little bit of discussion about this article. It had some good points, and I think that its focus was towards your standard RN bedside nurse, and saying that they should get out and they should be part of organizations like the American Nursing Association, which the author was a proponent of and a member of. And that it doesn't really focus on any real specifics on how to actually really get out there and get dirty and change legislation. But it's interesting progression on how to look at changing legislation.